7 audio lecture, and this is the first thing we're going to cover for Unit 2. So Unit 2, we're going to be looking at the skeleton. We're going to skip Chapter 6, and we're going to start with Chapter 7, just because a lot of things that we have to label for our practical are going to be in Chapter 7 and Chapter 8. So we'll kind of do those first, and then we'll go back to Chapter 6, which is a lot of just definitions and kind of the physiology stuff and all the things that are going to end up on our lecture exam. Okay, so this way we can kind of start practicing our labeling, make sure we're ready for the practical, and then we'll move on to our physiology stuff. So the first thing you already want to look at is just basic definition. So you want to know that your skeleton, and again, we're talking about the bones and some other things, but it's basically just a dried up mummy, right? Dried up body. It's composed of bones, cartilage, joints, and ligaments. Your cartilage is going to cover bone in certain areas. We're going to talk about that as we get into arthritis, and especially when we get into the joint part of this unit. We're going to have ligaments. They're going to connect bones. Again, ligaments are going to connect a bone to another bone. They're going to help to reinforce the joints. When you're talking about a tendon, that's going to be a muscle attaching to a bone, and we'll get into that in the next unit. So joints are going to allow for movement between bones, and then one of the main things we're looking at in this chapter is that we have two parts of our skeleton, and one is going to be the axial skeleton. That's what we're going to look at in part 1 and 2, and then we're going to look at the appendicular skeleton, which is going to be more our arms and our legs. So when we're talking about the axial skeleton, we're talking about three major regions. We're talking about the skull, the vertebral column, and the thoracic cage. And this is an important thing that comes up on your exams all the time. They'll be like, okay, which is not part of the axial skeleton, or which of these is not part of the appendicular skeleton. So you want to remember that when you're talking about the axial skeleton, you're only talking about the skull, the vertebral column, and then the thoracic cage. So it's going to form the longitudinal axis of the body. It's going to support the head, the neck, and the trunk, and it's going to protect our brain, spinal cord, and our organs. And we're going to look at a picture here in a second too. Okay, so when you're talking about axial, we'll see everything going down the center here, and then when you talk about appendicular, it's going to be everything else. But the important thing to remember is skull, spine, ribs, that's axial. Everything else is going to be part of that appendicular skeleton. The part that confuses people is going to be more like the pelvis, and then we'll look at like the scapulas when we get to the upper extremities. But those are the things that people kind of forget, is that those two things, and especially the pelvis here, that is part of our appendicular skeleton and more of our legs. And the only thing for the axial, again, is skull, spine, rib cage. Okay, so those pelvises and the girdles and things like that are going to be, again, part of the appendicular. Now we get to the skull, and again, a big part of this unit is the skull, but one of the things I want to remind you is, like, don't get so caught up in the skull that you skip and you don't spend a lot of time learning all the extremities and the scapula and the girdles and the arms and the legs, okay? Because a lot of people kind of get so wrapped up in the skull and they forget that this unit is everything. So, when you get to especially your practical, if I have 50 questions, 40 of them are not going to be on the skull, okay? So focus on the main things. Make sure you know the main parts of the skull, make sure you know the important things that we're going to kind of cover, and then make sure you're spending just as much time on the arms and the legs and everything else, because again, there's going to be, there's landmarks for every part of the body, but when we come to the practical, there's going to be, a couple questions on the humerus and the radius, and it's going to be evenly spread out, so don't get so caught up in the skull that you miss all those other points, okay? So the skull is the cranial and facial bones. It's going to enclose and protect the fragile brain. We're creating attachment sites for the head and the neck muscles. We're going to have sutures that are going to firmly unite the bones of the skull. This is really, really evident when you're looking at a newborn. And then the major skull sutures are the coronal, sagittal, squamous, and lambdoid. And again, a lot of these we've looked at when we talked about the plane. So we're familiar with coronal plane, we're familiar with the sagittal plane, and they're going to be kind of along the same line. So some of it will be, if we know our other stuff really well, some of this will be kind of repetitious. So here is our sutures. So there's our coronal plane, okay, and there's going to be our squamous here, and then we're going to look at the sagittal, and then we're going to have the lambdoid, and again, these are just good for labeling purposes, okay, so you want to make sure that you can label all these sutures when it comes to our practical, and then we'll start looking at what are the bones that actually make up the skull. So now we get to the facial bones, and we're going to talk about they're going to form the framework of the face. They're going to contain cavities for our special sense organs, and you're going to have a lot of nerves that kind of come out of your brain, and they're going to have to go through these little areas into the skull and kind of get out to the face too. But when we're talking about special sense organs, we're talking about sight, taste, smell. We're providing openings for air and food passages. They're going to secure the teeth, and then they're going to also anchor the facial muscles of expression, and we'll see that again too. And you want to look at this picture, and you want to kind of realize that I have a lot of cavities. A lot of times we think of our skull as just this big, huge, kind of thick bone. But remember, there's a lot of openings in there, and there's going to be a lot of things in there that, again, are really sensitive. So we're going to really, really try to protect them with this very, very strong protective skull. Okay, but you get your orbits, your oral cavity, cranial cavity, get all these very sensitive structures that need to be protected really, really well so that they don't get damaged all the time. Okay, so now we get to skull geography, and again, this is really, really important for our practical purposes, and we want to be able to label, not just the sutures, but we want to be able to label all the important things that make up the skull too. Okay, so you have the cranium, and it's going to be divided into two parts. You're going to have a cranial vault, and this is going to be the bald part of the skull. So it forms the superior, lateral, posterior. This is also a good chapter where you want to have that textbook beside you so you can kind of have the pictures as we're going over things. But cranial vault is the bald part of the skull, okay? And then the cranial base is going to form the skull's inferior aspect. It's going to be divided internally into three distinct fossa. We'll see a picture here in a second. And it's going to be anterior, middle, posterior. And again, you want to make sure that you can label these distinct fossas. Okay, and your brain is going to sit snugly in these fossae, and it's going to be completely enclosed by the cranial vault. Okay, so here is my cranium. Okay, and if I look at this picture, and this is in chiropractic school, they used to have a day where they would come in and kind of cut the top of the head off of your cadaver, and they would take the brain out so that you could use it in neurolab, but you would get a really good, way to observe these little fossas, kind of once they take the brain out of the skull, and you can see how it kind of sits in these little fossas, and it keeps it nice and safe. Okay, so anterior cranial fossa, middle cranial fossa, posterior cranial fossa, and I can already start to see where I have all these little openings for all these little nerves and parts of the brain that are going to have these branches of these nerves that will go to all these different places for me. Okay, so make sure you can label those. We're going to have a lot of smaller cavities and openings. So you have middle, internal ear cavities, nasal cavities. You're going to have your orbits for your eyes. You have 85 named openings. There's a lot of different structures kind of on the skull. So they're going to be foramina, canals, fissures. They're going to provide passageways for blood vessels, spinal cord, cranial nerves. But again, we're going to focus on the main bones. There are some important ones that I'm going to kind of point out. But again, don't get caught up in learning these 85 named openings and forget about the rest of the body too, okay? Because I'm really going to just try to focus on the main important ones of each kind of part of the skull. So now we get to the cranium, and this is, again, you want to know the main bones first and then sort of branch off and find the really, really small structures. So there's a frontal bone, which is going to be the anterior part of the cranium. There's going to be a parietal bone. It's going to make up the superior and lateral aspects of the skull. You're going to have an occipital bone. It's going to form the posterior part of the skull. And then you're going to have a temporal bone that's going to do the sides of the skull and sort of towards the ear. So the first thing I want to do is just make sure that I can find all of these. And it's always nice in these pictures because they're color-coded. But I want to be able to make sure I can find all of these bones from every direction. So looking at the side, the front, the top, the bottom, I want to be able to name all the main parts of the skull. Okay, so find my frontal bone, find the parietal bone, okay, find the temporal bone, find the occipital bone, and then again we're going to move things around and sort of make sure we can name them from all these different little directions. But this is where you want to start, okay, and then we can sort of start to look at, okay, what are some important parts of the temporal bone, or what are some important parts of the occipital bone. Now we do the same thing from the front, okay? And it's always good to kind of orientate yourself first when you're trying to label anatomy stuff. So make sure you realize, okay, am I looking at it from the front, the top, the side, upside down, all those different things. That's the first thing you should do every single time you look at a picture, okay? But you can see, I can see my frontal bone. I can see part of my parietal bone, part of my temporal bone. And then again, we want to look at it from the back. And again, I can find my sutures, okay? But I can still see my parietal bone, and I can see this occipital bone at the back, and I can see part of my temporal bone. Okay, so make sure you can find all those main parts of the skull, but again from all these different directions, and make sure you still know know how to label those sutures too. Now we get to the temporal bone, and this one does have some things that we want to be aware of. So again, we have this opening for our external acoustic meatus, or for your ear, for your hearing. We're going to have this zygomatic process, and again, I can feel kind of my cheekbone, and I can follow it back towards my ear. and I can start to sort of palpate these things. And again, these are really good things where anything in, the arms or the legs or the scapula or the pelvis or up into your head, you can kind of put your fingers on and find like this mastoid process is just that big huge bump behind your ear. You want to do that because it'll actually help you remember stuff. Okay, so anytime you can find things and palpate things, you want to make sure you do that because again, it'll help you to remember what's kind of located on each bone. So temporal bone is again on the side, but it has some distinctive features that again you're going to be responsible for labeling. And again, you have your objectives. I'm going to give you another list of the things that I really want you to focus on for landmark wise for the bones. But you want to be able to go through that list, and you want to kind of use the images and the pictures from your textbook and your manual, and just make sure you can label all of those things on these pictures. Now we get to our cranium continued. These ones always kind of trick people a little bit, but we have these sphenoid bones. Okay, these are going to be a bat-shaped bone. It's going to span the middle cranial fossa. It's going to connect all other cranial bones together. This is always a question on your multiple choice, is that which bone kind of connects everything, or which bone are all the other bones connected to, and that's going to be the sphenoid. And again, you want to remember that's the bat-shaped one. Ethmoid is going to be a little bit more towards the front. It's going to be a little bit more towards your nasal and your nose. So it lies between the sphenoid and the nasal bones. It's going to form the bony area between the nasal cavity and the orbit. So when I think of ethmoid, I always think of sinuses. And when I think of the sphenoid, I always think of that middle part and that bat shape. But again, the pictures make it really easy too. Okay, so here is my sphenoid here. And then when I get up into the front part, I'm going to be looking at my ethmoid. So again, you want to realize that the sphenoid touches all the other parts of the bones, and you want to think of ethmoid. You want to think, okay, it's going to be a little more anterior. It's going to have a little more to do with my nasal passages and my sinuses. But again, this one, the skull is cut in half, and I want to make sure I can name all the bones. I can find the sutures, but again, in this one, I can see those middle parts of the skull too. So I get those two more bones in there. And here's a picture from the top. So here is my sphenoid, and we start to look at that sort of bat-like structure. And then I move a little more anterior, and I find that ethmoid. But again, sinuses, this is that really middle part of the skull, and you can again see with the sphenoid that it's touching all these other bones in your skull. So now we get a closer picture, okay, of the sphenoid. You can see where I get a greater wing and a lesser wing, and again, that's how it gets that bat-like appearance, okay? And then I can take that and I can transpose it kind of into here and kind of fit it in a little better so I can find those structures too. And then I can look at the ethmoid, and I can see this little picture here of where it's going to kind of fit in there. But I can see where this is kind of dividing my nasal passages a little bit too. But the most important thing, again, is just making sure you can label the sphenoid, making sure you know the ethmoid. And again, this is one that everybody kind of mixes up. But again, sphenoid is in the middle. Ethmoid is going to be a little bit more anterior towards those nasal passages. Okay? Now we get to the facial bones, and these always come up with your multiple choice questions too. So we want to make sure we can label them. So we have our mandible, which is the proper term for the lower jawbone, largest and strongest bone of the face. You have your maxillary bone. It's going to form that upper jaw. And again, you want to kind of put your fingers on your jaw, find your mandible. You want to put your fingers in that upper part of the jaw, find the maxillary. So this is my central portion of the face. Articulates with all facial bones except the mandible. And then I have my zygomatic bones. And those are going to be what we think of as our cheekbones. So we come back to this picture, and we find all those things. So we find the mandible, we find the maxilla, and then we find our zygomatic bone, right? And then I still want to make sure I can find all the other bones that we've kind of looked at already. But I start to look at, okay, I have this cranium, and then I have these facial bones towards the front. Okay, and here's a picture of your mandible, and you have this little condylar process here, and it's going to come up and fit in this little groove on your temporal bone and sort of create our temporomandibular joint or our TMJ joint. Okay, but you can see where my teeth are going to fit into the mandible, and then my upper teeth are going to fit into that maxilla. And then here's your TMJ, and this is one of those things where with jaw pain, we get a lot of this at my office for acupuncture and different kinds of therapies. But you want to think about this little part of the mandible is just sitting in this little groove, okay, on your temporal bone, and we have this little disc in there, but very, very common spot to have a lot of discomfort and a lot of pain. And one of those things that you want to really get jaw pain taken care of as quickly as possible, because as it lingers, it can be just very, very difficult to kind of get a handle on. So there's some things you can afford to wait, TMJ or jaw pain is one of those things that you wanna get taken care of right away. A lot of people, you can do a simple little test where you're staring in the mirror and you can just open your mouth real slow, and what you'll see is that your jaw will start to sort of move off center. It'll sort of move to one side and come back to the center, but that's telling you that the muscles on one side versus the other are getting a little imbalanced. And a lot of people throughout their whole life, they'll chew always on one side, they'll chew gum, they'll chew their food, and we create these little imbalances, and it starts to put these forces, and this makes that those jaw movements and sort of biting down a little bit more difficult. Okay, so jaw pain, you want to go to your doctor, you want to get it checked out as soon as you possibly can. So here's just another cool picture, a bite force, and again, the forces that are created with biting or sort of grinding your teeth or bringing your teeth together can be pretty astronomical. This is just a list of all these different little animals here, but you can see that we're kind of way down on the list, okay? So our ability, and sometimes these will kind of surprise you as to what animals kind of have the strongest bites. So now we get to the hyoid, and this is one that it's not super important, but again, it always comes up on multiple choice tests. So this bone is going to lie anterior in the neck, and it's going to be just inferior to the mandible. It's going to actually look like a miniature version of the mandible. This is the important part. It's the only bone in the body that does not articulate directly with any other bone, so it's really not touching any other bone. Anytime, when you're going through any chapter and you find some sort of thing where it's the only one that does this or the most common, those are the things that you want to highlight and start because they're, again, good multiple choice questions. So a lot of times they'll say, hey, which of these bones does not articulate with any other bone in the body? And the answer is going to be that hyoid bone, okay? And it's really just an attachment point for neck muscles. It's going to raise and lower the larynx during speech and swallowing, and you can, again, put your fingers kind of right on there and you can swallow or you can talk and you'll feel it kind of moving around. So here is a picture of the hyoid, but again, does not articulate or come into contact with any other bone directly. Now we get to the orbits. So these are the bone cavities in which the eyes are firmly encased. They're going to house the muscles that move the eye. They're also going to house the lacrimal glands that are going to make our tears for us. They're going to be formed by 7 bones, okay? So frontal, sphenoid, zygomatic, maxilla, palatine, lacrimal, and our ethmoid bone. And again, this is another good multiple choice question where they're like, hey, which one of these does not form the outer orbit, okay? So that's, again, we want to kind of make sure we can label them, okay? But again, for multiple choice questions, this is one of those things that always kind of comes up too. So you can see this picture here, and we can kind of label all the bones that we've always talked about. We only really added 1 or 2 little bones in there. But you can see how your orbit is made up of all these little bones here. Okay, so just make sure you can kind of list which ones are part of the orbit, and then I can know, hey, this one is not going to be part of the orbit. So now we get to the nasal cavity. So it's divided into a left and right parts by your nasal septum. Most of us know, especially when we're sick, we get real stuffy on one side, and one side we can still kind of breathe of. But we're going to add a few more bones in here. We're going to add the vomer, which is going to be inferior. We've already talked about the ethmoid. That's going to be superior. And again, we're trying to divide and sort of create our sinuses here. And then we're going to have our septal cartilage, and that's going to be anterior. And we'll look at a picture here in a second too. Okay, but your nasal septum, your nasal sinuses are going to be covered with mucus, secreting mucosa, and it's going to warm the air as it enters, and it's going to help to clean any sort of debris out of that air before it can get into your lungs. The swirling movement of the air is going to bring it into contact with the warm, damp mucosa, and again, we're trying to trap any sort of airborne particles before they have a chance to move down into your lungs. So here is our little picture here, and again, we sort of know the sphenoid, right? We looked at the ethmoid. We're sort of adding the vomer here. We can see our septal cartilage, and then we have this little palatine bone as we get towards our little palate here. Okay, so these are the ones that are a little tricky because they're a little more internal part of the skull, but we're creating these 2 little nasal passageways. Okay, and here's another picture which is just really important. I just added this one in here from another book, but you want to remember that when I'm breathing air in through my nose, okay, I'm trying to get it sort of down into my lungs. So again, you just want to make sure that you're aware of, okay, where is this kind of going to? But again, we're going to try to trap any sort of airborne particles in here before we go down into our lungs and kind of get into those little more sensitive kind of areas, okay? Because we have and again, you got your esophagus for your food, you got your trachea, but I'm breathing in all this air, I'm trying to move it down through the trachea, and then eventually it's moving down towards my lungs. Now we get to our paranasal sinuses. They're going to be made up of the following bones, so frontal, sphenoid, ethmoid, and our maxillary bones. These are also going to be mucosa-lined, air-filled sinuses. This is where you get a cold or you have a lot of allergies and you start to feel really congested. These are the parts that are going to start to feel really, really pressure-filled. Their small openings are going to connect the sinuses to the nasal cavity. Okay, and then we're going to allow air to enter. We're going to have a mucosa formed by the sinus mucosa that's going to drain, or mucus formed by the sinus mucosa is going to drain into the nasal cavity. And again, we sort of know the passageway of this a lot of times too, because as we get really stuffy and our sinuses start to drain, we kind of feel all of these things sort of moving down towards the back of your throat. But the mucosa is going to help to warm and humidify inspired air. And it's going to also help to lighten the skull and enhance voice resonance. So a lot of times we're having these little open pockets within our skull, so there's just not this big, huge, just layers and layers and layers of bones, which would make it really, really heavy. So we're adding these little pockets here and these little sinuses to help sort of warm and humidify the air, but it's also going to keep our skull from being too heavy. So here are our sinuses, and again, when we get sick and we start to feel that pressure sort of build up as we get real congested, a lot of times this is where you'll really feel that pressure, sort of right by your eyes here, sides of the nose, and then sort of right on, those little cheek parts right beside the nose a little bit here too. And a lot of times when you can do, we'll do a lot of massage and acupuncture and things like that for people's sinuses, but these are the spots that are going to be really, really tender. And these are also the spots that you're going to do acupuncture on to try to increase the circulation and help your body just drain your sinuses out a little bit better. Okay, here's our picture from the side. And then here's a picture of the acupuncture. So you can see when you're doing acupuncture for someone's sinuses, you're kind of just hitting all those anatomical sort of parts. And again, when you put that needle in there, your body's going to increase circulation to wherever that needle is. And in doing that, it'll help your body to sort of drain those sinuses a little better, keep things from getting backed up, and it'll keep a lot of people from getting any sort of different little sinus infections. So here are some pictures here that we just want to make sure as we go through this part of the chapter, these are great because they give you just little summaries. But again, you want to kind of be able to look at the skull from all these different little orientations. So from the side, from the front, from the back. And I want to make sure that we can label all of the bones that we just talked about, but again, from all these different little angles. Okay, so these are great pictures from your textbook to just look at as you review at the end or sort of have beside you when you're going through things. And again, you want to find all the structures that we just talked about from all these different little angles. Okay, and this one is the upside down one, but again, I can still see, the first thing you do again is just orientate yourself. Am I looking at it from the top, the bottom, the left, the right, from the front, from the back? And then you want to sort of label things in the same order, and that again will help you sort of keep from missing things. Okay, the next thing we're going to do in part 2 of chapter 7 is we're going to look at the second part of the axial skeleton, which will be your vertebral column. And again, we're going to break this up in a few different little sections just to make it a little bit more digestible. And then once we do the axial skeleton, we'll move on to the appendicular skeleton.